Hi, everyone. Welcome to another edition of Social News Interviews. I'm your host, Leila Gulen. If you've scrolled through Instagram or TikTok lately, you've probably noticed how beauty trends can change virtually overnight. From viral skincare routines to AI-powered apps that reshape how we see ourselves. Well, these aren't just passing fads. They're influencing how people think about their own skin, confidence, and even the treatments they choose. Well, joining us is one of the nation's leading experts, Dr. Sonia Bansal. She's the co-founder of Elite MD Spa, a trusted destination for advanced dermatology and aesthetics. And for more than 20 years, she's helped everyone from everyday patients to celebrities around the world look and feel their best. In this interview, we'll hear her unique perspective on where beauty is headed and what that means for all of us. Welcome to the show, Dr. Sonia.
Thanks for having me, Leila. Great to be here.
All right. Well, in a world where celebrities and AI beauty filters are reshaping how women perceive themselves on social media, how do you help real women embrace their natural beauty while still achieving their aesthetic goals?
Well, Leila, I think you hit it right there, the nail on the head. It's all about embracing your natural beauty. We know that we've got social media filters everywhere. We've got people that are literally turning into different people, and they're all wanting to look like their favorite celebrities, or they like certain features and wanting to look very similar to and try to aspire to be other people instead of embracing your own confidence. And that's what we bring at Elite MD. It really is a natural glow, embracing your unique features, celebrating your heritage, celebrating where you came from. The goal isn't to just copy a filter. So I have patients will come in and say, I don't like this line or wrinkle or blemish. And the key is not to erase every line or wrinkle and look unnatural or to look like a filter. It really is to embrace all of your beautiful features. So I start the consultation with exactly that kind of question. It's not what brought you in here, what don't you like about yourself? I started as, what do you love about yourself? What features do you love? Because I want to make sure that I really bring those out. I want to enhance those features. A lot of my women want to go for that no makeup look. So they're really looking to have wonderful, refined skin. They're looking to have some of their lines and wrinkles blurred out. It's really about still glorifying all of your wonderful features, but allowing us to just tweak that a little bit and not changing who you are. So truly the beautiful filter, the best one that you can ever choose is the one that you don't need. It's really just your own confidence.
Well, tell us more about your story, Dr. Sonia. Why did you decide to become a world-class dermatologist, and how did you end up empowering women around the globe?
Well, to me, it's more than just medicine. It's more than just beauty. Truly, I'm here to try to help empower your life, help transform your life, in some cases, even save your life. I get to see the full spectrum from medical dermatology all the way to aesthetic dermatology. Growing up, I myself had acne. I myself had issues, hyperpigmentation. I grew up in a culture where having even toned skin and having fair skin was valued. And so colorism is really also a part of a lot of culture, a lot of cultural barriers on how you perceive yourself. So I was so blessed. I had some amazing mentors in medical school. But the one thing that I noticed was there was absolutely a gap in medical education. And in that medical education, I didn't get much in terms of skin of color, much in terms of nutrition, much in terms of wellness. I, got one of the best, the institution that I was at really taught the best in dermatology, but I had to go and seek out some of those more special areas that I bring into my practice today. So I'm just so grateful that I was able to do that and bring that world-class level into my practice. One of the things that I've noticed with all my patients is that there's always a common thread. I can go and knock on the first door and I'll have a fair skinned patient who's coming in to tell me, you know what? I love your color. I want to be as dark as you. Make me as dark as you. And they're going out and tanning and doing all sorts of things to have that golden hue. And then I'll go to the next room and I might have a skin of color patient and they're trying to say, make me as fair as possible, as white as possible. And so the commonality here is that everyone is trying to fit into what they believe is a standard of beauty that truly doesn't exist. You were born to stand out. And that's really the commonality that I do see, is that the confidence has been, you know, lowered because they believe that there's this beauty standard that everybody has to live by, which is unfortunate. So we try to really bring some of that empowerment back to them.
Well, Dr. Sonia, can you share some insights about your core values, mission, vision at Elite MD, or for yourself personally?
Absolutely. I mean, we have, we thrive on our mission, which includes trust, transformation, service, and health. At the end of the day, we want everyone to be at optimal health and feel empowered. It truly runs within our lifeblood, within our staff, within ourselves, our personal lives. So we don't give patients just what they come in for, what they're asking for. We truly take a good wholeness and holistic look at them and give them what they need. And that's the difference. We don't mind saying no when we're giving, offering a procedure that you don't need. A patient might come in for a spot that they're worried about on their face, but I might find a more worrisome spot on their back. They might come in thinking they need a surgical procedure or a facelift because that's what they've been told. But in fact, they don't need that. They might need more of a simpler, non-invasive procedure to give them a better result. They might come in thinking they need Botox and fillers, but in fact, they need a surgical or surgery to give them the final result that they're after. So I think that's what's really important, is knowing when to say no. We're so fortunate that we get to be in a combined dermatology, laser, and plastic surgery institute where we've been practicing for over 15 years. Only 1% of offices practice the way that we do. We're fortunate that we really have the right tools in our toolbox because we can give this combined approach. We've done thousands of procedures for people all over the world, and for us, safety is the most important. If you can't trust us with safety, we don't have anything. The natural results is another key part of what we do. If you want an overdone or frozen appearance, we may refer you out somewhere else because that's just not what we do. And I think that's what's really important to realize, is we really customize that approach to you and really look at your, again, natural beauty and give you the best result that's safer and more effective, that also meets your goals. So we've had patients that come in for, we always tell patients go in for 3 consults. And what you'll find is that a lot of times they only recommend one option. Maybe if you go to a plastic surgeon, they're going to recommend surgery. If you go to a dermatologist, they might recommend a non-surgical approach like a laser. But the difference is that when you come to us, you're going to get dermatology options, plastic surgery options, and laser options. We're going to combine these to give you the least invasive and safest option that is going to give you the most natural results. And I think that's what people really appreciate about us. So I think that's what makes Elite MD completely different than any other practice.
Well, I think a lot of patients, they really do appreciate that holistic approach. Now, you blend Eastern and Western medicine in your treatments. How does this holistic approach change patient results?
Well, we love to be able to do combination approaches. And this is one of the most key and most important thing that we do, is we're able to combine East and Western philosophies. We know medicine's powerful. We know meditation is powerful. We know lasers are powerful. But imagine when you're able to actually combine all of this and the results that we can get. I'll tell you, we are going to get much better, safer, and more lasting results. That's true magic. That's transformation. So where I grew up, in India, we practiced a lot of Ayurveda, which is Eastern philosophy. So building in some of these ancient traditions is so valuable when you combine that with modern science. I was lucky. I grew up in America, the land of the American dream, and education was at the forefront. But with that, I was able to really take advantage of the tools, the resources, the advancements that we had here to really put that into my personal life. And at Elite MD, that's exactly what we do. When you come in for a consultation, we're, again, not just doing a one and done procedure. We're not just doing surgery. We're really combining all of those aspects of modern medicine with innovation, along with all of the Eastern philosophies, which are much more holistic. I think people are more on trend to do things that are more natural and more holistic and that are safer for you. So what's wonderful is that when we have a patient that'll come in for a procedure, whether it's with derm or plastics, they have the option to see us for life. We offer an elite concierge program so that when we are talking about things like nutrition and diet and movement and exercise, all of these things are going to impact their results so much better. We call it the 30-30-30 rule. So 30% of what we do is going to be based on what you do at home. 30% of it is what we do with you in the office. And the other 30% is the universe. So imagine if you're doing your 30% with modern medicine and Eastern philosophies, we're getting that much better results. So we take a different path. We don't just do one and done. We're really combining the best of both worlds.
Now, on your website, Dr. Sonia MD, you showcase 5 pillars of health. What are your 5 pillars of health, and how do they apply to looking and feeling younger?
So my 5 pillars of health are just total wellness inside and out. And it's really looking at the 5 vital organs that we try to target during our consultation. So the first organ, we know we will want to capture the physical body. It's all about nutrition, eating well, plant-based diet, what we call no meats, no wheats, no sweets diet, because we want to cut down the inflammation. We want to focus on movement and exercise. A patient who comes in who wants to do GLP-1s or wants to focus on weight loss or wants to help with looking better in their dress or their swimsuit through liposuction, we're not just doing a procedure or injection and we're done. We're really trying to incorporate all of these pillars so that they get much more lasting improvement. The same is true with the next organ, so brain. Brain is important because our mental wellness is just a big part of that. You know, stress becomes one of the biggest things that I see with all of our conditions, whether it's lipo, whether it's acne, anything that I'm treating also has to do with mental wellness. I think there's this a statistic that says that we have anywhere between 6,000 to 6,000 thoughts in a day. 90% of these are the same ones from yesterday, and most of them are negative. So we really have to control our mind. And so mindset is really important. Intention is so important. By just fixing this particular organ, the brain, and helping with mindset, we can actually help a huge part of everything that we see, from acne to, people who want to lose weight. The next organ is heart. Heart is so important because this is where our emotional well-being is. This is where we're trying to connect. We're connecting to community. We're connecting to our partners. We're connecting in relationships. We're connecting within our soul. This is what's going to really offer purpose. And when you have purpose, you've got health. And so this is another area that we'll focus on with service and connection. The next organ, of course, is going to be skin, our largest organ. Patients come in saying, I want that glass skin. I want that dewy skin. Where do I start? So important to do the basics. Keep it simple. Start with what we know is going to help your skin. And that's going to be a lot of protection. We want to be proactive, not be reactive to your skin. So sunscreen, vitamin A, antioxidants, this is like the holy grail, the triple threat. This is where the basics start. If you don't do that, it doesn't matter anything else you do. You're just not going to get the result. And then finally, of course, because we focus on hair, hair is my next organ. Patients want to come to me for stronger, healthier, thicker hair. And so we start with the basics, starting them on oral medications or things that are science-backed. It's really important with medical grade products that we really look to see what really works, what doesn't. There's absolute difference between getting something over the counter and getting something that is a medical grade or a prescription grade formula. I can add a drop of vitamin A in a retinol over the counter and say that I've got the same benefits. That is not FDA regulated territory versus if you get something that is medical grade, You are getting something that's science-backed. It's got the right ingredients. It's got the right concentration. We know that they're active ingredients. There's science to support it. So those are my kind of holy trinity, is start with some of those basics. And I've seen people who, when they are really combining all of these, things from 5 pillars and just starting with the basics and then incorporating procedures, I mean, we see magic. This is where we can reverse years of damage. We can start regrowing hair. We can do so much more when we have all of these areas of interest all working together. Everything aligns so beautifully, and the beauty is that you actually see the long-term benefits.
Well, we did some research and discovered that you've been a global ambassador for Procter & Gamble since 2008. That is so impressive. How has that shaped your influence in the beauty industry, and what role do you play in developing new skincare products with P&G?
I've been in such a fortunate position where I've been able to work with some of the best industry partners over the past 2 decades. I've worked in research and development. I've worked in advisory boards, consulting to really give you the best of the best science-backed products. I'm not here for quick fixes or miracle creams, but truly it's got to have the science. It's got to have the clinical studies to support the outcome. And that's what excites me. And in working in this space, I definitely saw that there was a big gap in this space. There was absolutely a voice that was needed for skin of color. And that was one of the most exciting things I was able to do, was to be able to fill a space for skin of color patients who had problems and now finally had solutions. I can't tell you how many times, even growing up, if I had hyperpigmentation left from an acne spot, I didn't know what to do over the counter. There were very few things that I could find over the counter. I, was fortunate. I was able to author probably a couple of dozen articles. I am the co-author on a leading skin of color book that is found in all universities. I've been in partnership with some of the best industries to really have that voice. And it is an absolutely underserved area. So it's just the start. It's still in its infancy, but I definitely use that as a global platform. And I feel a responsibility and advocacy to be able to fill that space. So Procter & Gamble is one of those companies that is really dedicated to improving that space. And what's great is that, I can bring a lot of that information and knowledge home to Elite MD. We have our own medical grade skincare line, which is backed by science, which is problem solution oriented, and it's for all shades. It's really formulated with ethnic skin in mind. And there's an absolute difference with skin of color and one that is, fair skin without all of the melanin. That melanin is a big target for a lot of conditions that we see. And so I'm just so grateful that I was able to work in this space and really create some, openings for so many companies to be able to fill that void in the beauty space and really, at the end of the day, have an impact on my skin of color patients.
Well, Dr. Sonia, with your extensive experience as a board certified dermatologist, what med spas services do you offer at Elite MD, and which of them do you enjoy the most?
So we're so different than a med spa and really any office out there. We are one of the largest aesthetic centers and training centers in the country, especially in Northern California. We see people from all over the world because we're a training center, because we see skin of color, because we hold ourselves to a higher standard of care, because we have stricter protocols. I'm a medical director, and I think safety is the most important priority of any office, but that is the one thing that I will absolutely instill with all of our staff and our patients. So we have stricter protocols. We've got experts that are really specialists in this field. They're focused on what they do the best. We work collaboratively as a team. So you literally have cheerleaders and a group of team experts that are rooting for you to give you the final result. We truly focus on transformation. We're restoring confidence. We are empowering you. We're educating you. We're really optimizing your true health through the 5 pillars of health, which, by the way, you can also download to get you started. But these are all the things that make us so unique that no other practice or office or med spa can give you. We offer things from facials to fillers to facelifts. We offer Botox to body contouring. So that's why we're able to offer all of the combinations that we can do that's customized for you. I focus on, my approach is different as well from any other practice. I focus on really targeting all of the depths of the skin. I call it the 3 Ps to pretty skin. So the first P is priming your skin. We want to prime it with medical grade skincare that's science-backed, that we know works. Once we've done that successfully, we go to a deeper layer, and now we're trying to do the next P, which is peel your skin. So exfoliating some of that dead skin layer, especially in the winter months, especially when if you've got dry skin. All of these things are going to help us penetrate even deeper into the skin. So your skincare products will work better. And now we hit the third P, which is procedure. So now we could do laser, Botox, fillers, any treatment, and we are going even deeper, which means for you, we're going to get a better result, a better transformative result for your skin. So again, it's not just one and done. It's not just one cream, miracle cream. It truly is a science where we are capturing every single depth to give you results. So some of my favorite treatments, one of them is a gold standard treatment that we do. It is laser resurfacing. If you were that baby boomer generation, fair skin, did that tanning booths, which I hope you didn't, but laid out in the sun with aluminum and iodine and all of these stories that I hear, like this is for you. This is the gold standard laser to literally turn back the clock about 2 to 5 years very naturally, very safely. It does the 3 Ts, we call it: tone, texture, and tighten. I love it because one treatment literally can help do so many things. You have so many benefits. It can help with lines, improving wrinkles, brown spots, sunspots, pores, acne, scarring. But what I really love about it is it also helps to prevent precancers and skin cancers, which a lot of these patients also have. So not only the cosmetic benefits, but what I really love is it also helps your skin health. So hopefully you have less skin cancers over your lifetime, you have less surgeries, and it really gives you pristine, wonderful glass skin. People can go out without makeup and they feel really confident. And again, this is where the combination approach, my 3 Ps, is what's really important. We get them started with your medical grade skincare, and then we get started with the peel, and now we do the laser, and we can go deeper to get you better results. Another one of my favorites is called the Elite Transformation Package. This one is awesome because I get to customize, kind of going into a time machine. Do you want to go back 1 year, 5 year, or 10 years? And we can actually reverse a lot of the damage, sun damage, skin damage in all skin types. So it truly is tailored and customized to your goals and your skin type and your age. So that's what people love about it, is that we can really tailor it to what you need, and also not only treat but prevent future damage. And it's carefully curated and designed just for you.
Yeah, Dr. Sonia, I don't know who wouldn't want to go back 10 years. Sign me up. But you had mentioned earlier Botox and fillers. So let's talk a bit about that. Botox versus fillers. How do you respond when someone asks, what's the difference and how do I know which one is right for me?
So great question. But in a nutshell, Botox has been around. It's the gold standard. It's been around for over 50 years. It helps with relaxing the muscles of facial expression. So in general, you're looking at it for like the upper third of the face, but it can certainly be used elsewhere. Versus fillers, you're looking at really helping to restore some of that lost volume. We're helping to contour. We're helping to do a lot of things in the mid to lower face. Now, the combination approach works better, just like we talked about with all of our other procedures. So it definitely is an art. It's definitely more customized. It's designed based on your needs, your goals, your skin type, and a multitude of different factors. It truly is an art. So not any one person is going to get the same treatment any other time. And even when you come in, you might come in for a treatment, the next time it might be a little different. So it truly is an art, but we're lucky we get to have tools in our toolbox that allow us to really give you the best natural, outcome without any surgery. The beauty is that I'll have kind of, all these generations that come, and it truly does take that artful eye to know how to sculpt and how to contour and what to do and not overdoing it. And there is a fine balance. So my younger patient will come in and they're, on Instagram, they want to look their best. So they're asking more for the contouring benefits. They're looking for, some subtle lip enhancements, maybe some cheekbone filling, versus my mature patient will come in. I'm doing a lot more supportive volume loss. So I'm really helping with sagging skin. I'm helping to really create more of a lifting in the cheekbones and other areas. My younger patient wants to look really snatched. My more mature patient just wants to look more refreshed. So there is this fine difference. And then I'll have my skin of color patient that comes in who's totally different. I'll probably use less Botox and less fillers because the melanin is actually very protective. But for them, it's more about helping with blurring out some shadowing or under eye circles or pigmentation issues. So they require less filler, but we're targeting a completely different area of concern for them. So it truly is customized based on what their needs are. And the goal here is not to have the frozen look, not to look done or overdone. I always say when you go to a restaurant, you can't see the good work. You can only see the bad work. And our goal for you is to make it so that no one has to know. So we want it to look natural so that people will say, wow, you look refreshed, you look more rested, you look younger, but they don't quite know exactly what you did.
And you also offer a few alternatives to traditional fillers, including an innovative fat transfer treatment. So can you tell us a little bit more about that? And how do these treatments compare in safety, longevity, and results to fillers as we know them today?
So with everything we do, remember, we don't want to look done. We don't want to look overdone. And anything we can do that's more holistic and more natural, we're big proponents of. So the alternatives to fillers, because a lot of people are worried about fillers and reactions and things like that. In fact, I dissolve more fillers these days than I even put in sometimes because they're so overdone. So what are the other alternatives? One of my favorites is what we call PRF, or platelet-rich fibrin. It's truly liquid gold. I had it done a few weeks ago, and it's incredible. We take out your own blood, and in your blood is just rich growth factors and stem cells, and they do all the work. So it's usually a series of treatments with minimal downtime and very natural results. I really loved it because it gave me just this instant glow, and it's all done without surgery. So patients really love that because there's no downtime and you're using your own stem cells, your own growth factors to create collagen in your skin. Another popular procedure is using Renuva. Renuva works by stimulating your own supportive tissue, namely fat in this case. And what people really love about this is that it's a longer lasting product. You're going to get longer lasting results. What's even better, there's some newer generations of products that are coming out, which are super exciting. So we can not only help with shaping and contouring, for example, doing a little mini BBL with Renuva, but we've got even better generation of these products coming out to also do breast augmentation or breast lifting, also helping with lines and wrinkles on the face and facial contouring. So a lot of this will be replaced with some of these new upcoming generations of products that are going to be more longer lasting, and you don't need surgery anymore. It can be done within an office setting in an hour with, just under local anesthesia. So people really appreciate not having to do the full surgery, the full anesthesia, all the downtime that it takes. So it's getting better and better. Another very popular procedure that we do is fat transfer, which allows us to be able to take fat out of one area where you may not want it, such as the abdomen, and put it in another area where you may want it, such as the mini BBL, right? Creating that contour, creating that contouring in the breast area, but we can also put it for facial contouring. It's your own fat. It's 100% yours. It's holistic. It's natural. And again, no one has to know. So again, more of a longer lasting result. And this is where we're able to actually combine different procedures to take out fat from one area, do lipo, but then put it in other areas to help with creating that beautiful silhouette. So there's so many things on the horizon. One of my other favorite procedures is actually doing a non-surgical BBL. Literally, you don't need surgery for this. It's creating your own body's collagen, and your collagen that's created is yours to stay. All done in an hour with very minimal downtime, very simple in-office procedure. So things are just getting better and better. I'm excited to see where that goes.
Well, Dr. Sonia, let's dive into the topic of skin care. Since you co-edited the leading textbook on ethnic skin for dermatologists around the world, what are your top recommendations for women with darker skin?
So we know that by the year 2050, over 50% of the population will be skin of color. And actually, it's probably even faster. So there's going to be a whole demographic change that's happening. It's already happening. And we know that skin of color has definitely some unique challenges. I will see a higher percentage of them having things like uneven skin tone, hyperpigmentation issues, melasma, which is that mask of pregnancy, that blotchy symmetrical pigmentation, which is very, very difficult to treat. Keloids and scarring. All of these are huge challenges for skin of color. And the danger really becomes when you're not using the right products and you're not doing the right treatments, or you're seeing a place that doesn't know skin of color and they're not experienced in our skin. That's when the real danger comes. And I have definitely seen issues with scars, permanent damage. We're a referral site center for skin of color and complications, and it's very difficult to treat once the damage has been done. So it could be something like a strong chemical peel, seeing an esthetician and not understanding skin of color. It could be going to another office, getting the wrong laser done. It could be using an over-the-counter product that you thought was safe, but in fact, it could cause pigmentation to get worse and lead to more permanent damage and permanent scarring. So these are all real concerns for skin of color. And a lot of providers and professionals and patients out there are just not aware. So my go-to always is to start again with the basics, medical grade skincare under supervision. I think that's really important because skincare is confusing. It is definitely confusing to know what to use for your skin type. And one of the big things that we do is that we will walk through every step with you. So when you get an Elite MD product, you're going to get started with prepping your skin. We talked about the 3 Ps of pretty skin. We're going to make sure you don't have reactions, you don't have complications, you don't have adverse events. Medical grade skincare will be higher in terms of the good stuff, higher concentrations of quality ingredients. Again, science backed. We know that they work. We know that they are safe when used properly and under supervision. So I'll put our patients on some brightening steps, a brightening product or a brightening kit. But the most important thing is, again, they're 30%, they've got to wear their sunblock, they've got to avoid the sun, they've got to make sure that they're really consistent, because consistency is king. Yeah. Once they're doing the basics, now I go into all of the layers of the skin, I'm going to get a better result. And I know which products and which treatments are going to be safe. Melanin is highly reactive. So when we're not sure about which treatment is right, that melanin is going to be very sensitive. It's going to get irritated, and it reacts by causing post-inflammatory hyperpigmentation, which is very devastating to a skin of color patient who has to go through that process, because it can take weeks and months to a year for it to actually fade with time. So as I always say, consistency is most important. We're helping to treat the challenging issue, but we're also helping to prevent future issues when done under supervision. So a skincare that is, given by Elite MD is always comes with a complimentary skincare concierge. So that way there's no questions. There's no, am I doing this right? We've got your back. It's literally like having a little Dr. Sonia in your pocket at home. So we're going to be following up with you, which over the counter, they're never going to do for you. We're going to make sure that we titrate your skin up slowly. We're going to make sure that you have consistency of results, and we're going to make sure that you're safe through it.
Well, I've looked forward to asking you about just about every question that I've asked you today, Dr. Sonia, but here's one that I was really looking forward to. Let's chat about the recent popularity of weight loss drugs like Ozempic and Mounjaro. They seem to have become the go-to trend, but many women are now discovering that it can lead to sagging skin and what's called Ozempic face. So what do you want them to know before starting these regimens?
Well, I think there's definitely an explosion of these weight loss medications, and there's going to be newer and newer generations, hopefully better, safer, and have great long-term data behind them. There's definitely pros and cons whenever you start on your weight loss journey with these medications. The pros are people can do really well and lose weight when they do it the right way and safely. It can also lower the inflammation in your body, which is why we use it, is actually more of a microdosing schedule, which is safer and it's more sustainable. We're able to lower the inflammation so that when they get procedures done, when they get their surgeries done, our results are going to be that much better. However, the cons here are they can give you this Ozempic face. Patients do become healthier. They can stop some of their medications, diabetes and heart medications, which is fantastic for total health. But that rapid weight loss can definitely cause some of that sagging skin, and you can really see this telltale sign that they've had rapid weight loss. And a lot of times they're also not doing some of the appropriate things that they should be doing. They're 30%, our pillars of health that we talked about, which is taking a high protein diet, making sure that they are doing more weight bearing exercises, because all of these are really important. The side effects are you do lose muscle mass. And so it's very important to be vigilant about protecting yourself so that you don't have another problem later on. So the beauty at LeadMD is that wherever you are in your weight loss journey, we can definitely help you with, again, tools in our toolbox. So if you've got that sagging skin, we have non-invasive treatments all the way up to surgical procedures, depending on how much weight you've lost and what your goals are. The 5 pillars of health is really the way to start, and then to get on these weight loss medications is going to be much more safer. So whether you've got the Ozempic face, you've got the sagging, we've got elite transformation packages, again, that customized package to really get you to the results you're after. We have, fat transfer and lipo, where we can actually take your own fat and put into areas where you do want it, because it truly is a whole body weight loss. It's not just your face. So we've got, tricks up our sleeves to really help with a combination approach. Or if you're early in your game and you just want to get started and find out more information, we also help with medically supervised weight loss. Again, more of the microdosing, because we want to lower that body's inflammation. It also helps with targeting a bunch of, several conditions and diseases to get you better. But what we love about it is that it can lower your inflammation safely and more sustainably over a long period of time.
So how does rapid weight loss from drugs like Ozempic contribute to, say, hair thinning? And can that be reversed?
Well, a lot of people think that the hair thinning is due to the medication, and in fact, it's not. There's a lot of shifts that's going on with rapid weight loss. There's shifts in hormone levels. There are shifts in your body. Thyroid is affected, stress hormones are affected, but then it also can uncover nutritional deficiencies as well, especially if you're not taking care of yourself, like the 5 pillars of health that we talked about. You're going to see the aftermath of that. So the important thing here is really looking at the root cause. And at LeadMD, that's exactly what we're doing, is we're really trying to get to the bottom of what this root cause is, so we can actually fix it for good and long-term and safely. There's definitely much more of a rise in menopausal women who are also noticing hair thinning, and they'll tell me, "Oh, I'm noticing something right here in the frontal scalp, and or I'm seeing more of that part show, or when I put up my hair in a ponytail, it's just a lot thinner. What is this?" And there's, again, lots of hormonal fluctuations during menopause. It could be nutritional. It could be a lot of different things. And what's important is to do a full workup and make sure we don't miss things, rather than just, get you on, what we think could be a Band-Aid treatment. So a combination of therapies is really helpful. We start with over-the-counter things that are FDA approved, such as minoxidil. We go into some oral therapies, some drug-free supplements and formulas, again, that are science-backed. We really help with the scalp as well, and scalp health. That's really important. We want to make sure there's nothing else going on, such as inflammatory reactions, psoriasis, what we call seborrheic dermatitis or dandruff. All of these things can impact losing hair and thinning hair. So we do a full workup and we make sure we really get to the root of the problem. Sometimes we have to do a hair biopsy to also rule out other things, such as autoimmune conditions, which can mask in a lot of different ways. So the important thing is that, hair loss is very complex. Your body is complex. And so the solutions that we give you really do need to have a full workup treatment plan to give you the best results.
How do you help menopausal women experiencing sudden hair loss? And can natural remedies like rosemary oil that we've been hearing a lot about actually regrow hair? Or is this more of a social media myth?
So menopause can definitely bring a lot of hormonal shifts, and we'll see that in the way that you present with hair thinning, with body changes, with weight gain. I mean, there's so many things that happen during this turbulent time for a woman. And there are natural remedies that do exist that do have some data, including rosemary oil. So I think that is a wonderful thing to do at home. Do it yourself, and it can potentially help with circulation. But really, it's all about a combination approach at the end of the day. There's so many root causes literally for hair thinning. We want to make sure that we are investigating and exploring all of them so that we treat them correctly. So a combination approach is really important. I had a patient who had come in who was in that perimenopausal time. She was losing lots of hair right here in her frontal scalp, which is a really common entity that we're seeing for some reason these days. And she was literally at our doorstep begging us to do hair transplant on her. And she was a case that we had to say, no, you are not a candidate right now. What's more important is that we really determine what the underlying root cause of this is. So we went through a special workup. We did some hair biopsies. We really addressed her medically first and really addressed her hormones, addressed her stress. She was going through an enormous amount of stress, not only with just her life, but then also her hair, which was just impacting all of this. So she had to do her 30%. We had to get her scalp hair back in optimal shape. And doing all of these things together is what really helped to improve her hair volume. So she definitely noticed a difference when we were able to get to that root cause by doing an extensive workup. Had we not said no, and we had done a hair transplant, this poor lady would have lost all of her hair. So it's so important with the timing and seeing an experienced provider, a board certified dermatologist, a plastic surgeon, someone who really knows hair and hair transplantation to really get the right answer, to get the right solution that's needed for you. Now, there are some people that never will need surgery in our hair graft procedures, and there will be patients of ours who we do all the medical workup and everything turns out negative, and turns out they've got more of this genetic hair loss or hair thinning. And in those situations, we talk about other options such as elite graft, which is our next generation in hair transplantation. So everyone is very different. Again, it's customized, but the important thing is that we do a full workup and really get to that root cause.
And of course, hair loss isn't just an issue for females. Many men struggle with baldness and are seeking solutions like hair transplants. And you had mentioned elite graft. What is the difference between elite graft and traditional hair transplant methods?
So that's a great question. Both my men and women who are experiencing hair thinning and hair loss are now looking for alternatives on what they can do. And there is a difference between a traditional hair transplant and a more advanced technique, such as elite hair graft. The traditional method is kind of, think of that as like your typewriter. It's, traditional, it's barbaric, it's painful. We're taking out literally in the back of the scalp a strip of hair. We're stapling that together, suturing it closed. We are leaving these telltale linear scars in the back. It's painful. It's got a longer recovery. Versus more advanced techniques such as elite graft. It's more advanced. We use innovative technologies that literally, it's all done under local anesthesia, so patients are very comfortable. We basically take out a hair follicle at a time and transplant it into the areas of interest in a very natural way. It is an art also to make sure that everything is lined up so that it looks natural and not done. My men get it done, and I check up on them all the time to see how they're doing, because it's my men that I worry more about the pain factor than my women. And whenever I walk in, they're literally comfortable or they're snoring, sound asleep, and I can tell that they, had a great experience and they're very, very comfortable. So this is why patients from all over the world have come to see us, because we truly have the advanced techniques. We are the iPhone of hair restoration and hair transplantation. And hair is a very, very personal thing for both men and women. It's part of their identity. I had a patient who, they were at a party and someone had taken a picture of, the party scene, and they happened to see themselves on the photo and they couldn't believe it. They were asking, like, who is that? And their friend said, well, that's you. And he had no idea that he had lost so much hair
Oh,
volume in the back. And he was literally in our office the very next day. But that's how important it is for both men and women. It's their pride, it's their identity, it's what they know. And especially if they've had, you know, thick volume and luscious hair all of their life. So it is a big deal.
so it sounds like you offer help with everything: skin, hair, facial rejuvenation, body contouring. Do you have any sort of special package designed to help the patient who just simply wants it all?
Absolutely. So at Elite MD, we are not a jack of all trades and master of none. We are a team that truly works collaboratively, that is focused in specialized areas to give you the best, most natural results. And the packages that we have really are curated and designed to be customized for you. Again, giving you that natural results with minimal downtime and without surgery whenever possible. So the Elite Transformation Package is a wonderful one for somebody who is looking for just that facial rejuvenation. The Elite Graft we talked about for hair. It's wonderful for advanced techniques with minimal downtime. Elite Sculpt, which is where our women and men want to look great and snatched, and we really make them look great in their clothing, their dresses, their bathing suits. It's a body contouring procedure. It's very popular. So we really stick to the combinations of therapies are going to give you the best results for you. We also have the Elite Concierge program, which allows you to also have continued wellness, continued holistic wellness with us. So we really have you covered. There's something for everyone when you come to us. We give you a customized roadmap in which to follow, and we basically handhold you your entire journey. That's exactly why we are this medical destination hub. So you don't have to go to overseas, you don't have to go to Turkey and risk your life and risk your hair and risk all of these terrible things that happen. You have a place that you can come to for just a seamless coordination, smooth service, where we're using all of the latest and greatest FDA cleared devices, all in combination with a team of experts. You'll have cheerleaders right there with you. You're going to have literally guardian angels. They're going to look over you. So this is where we are totally the total package.
Wow, that sounds incredible. I just love that one-stop shop, very seamless to get all those services. Can you share some of your favorite transformations or inspirational stories?
Oh yeah, there's plenty to share. So some of my most memorable stories really are quite incredible. I had a patient who came from Boston. She literally put herself on a plane and came to us with hope in her suitcase. She was from Kenya, went through a child marriage. She was married at, I think, like 15. And her husband, who was like 10 to 15 years older, would put out cigarettes on her skin, on her chest. And this is a skin of color patient who will not heal well. So she had all of these keloids in her chest area. They're very painful. She was just in agony and in pain, obviously very disfiguring. And she came to us literally to help her and cure her. And thankfully, I had my whole team there on that exact day that she came. So I literally pulled my entire team, our two top plastic surgeons. One of them was my mentor, who actually was taught Terry DeBro on
Yeah.
botched. So he's seen a lot of botched cases. And he came in and just started speaking Swahili with her, really put her at ease. And I didn't even know he knew Swahili. We put together a whole treatment plan for her keloids. We really coordinated everything. There were some surgeons in Boston that we coordinated her care, our colleagues there. I could tell she was in a lot of financial distress. We actually booked a ticket for her back to make sure she got the support and care that she needed. And I'll never forget, she left there. I still have a video, and she left there with, it wasn't, her scars that I saw. It became more about her spirit and the hope that she had that was renewed. She left smiling, in tears. She left like this 10-minute testimonial for us. It was just so sweet. And I really wanted to like just honor her because she went through so much and she really trusted us with her care, flying halfway across the country just to come see us. So we were just so thankful we could restore her dignity. That was so important to me. Another patient of mine who, and this is a typical example actually, in many of our patients who end up going on weight loss medications or not, or they just do our 5 pillars of health and we tell them the right way to eat and just go through a dietary plan. No meats, no wheats, no sweets is kind of our mantra. So this patient was from the South. And we told her no meats, no wheats, no sweets. Now, to put this in perspective, it's like saying to someone like me, an Indian person, don't have curry for the rest of your life, right? Not easy to do. So she was just flabbergasted about this dietary program. But you know what? She was so motivated, so inspired to do it. She did it. She ended up losing like 80 pounds. She went from double digits to a size 7. She comes in wearing her sexy dresses and her short dresses, full of confidence. And, she wanted to sign up to be our ambassador so that she can help other women like herself. She ended up doing a fashion show for us. We have a lot of patients that come in to share their story, and they're on this red carpet fashion show. And it's just a fun event. And she shared her story. She talked about how she became a change maker also for her household. She became a change maker at her church and just in the community. And that's what it's about. It really is just this community effort that comes together. One person can change a community. I had another patient who was a mom of 4 kids. She was always tired. She had brain fog. She had some headaches. I mean, it's kind of typical thinking, oh, is it just me being a mom and working too hard? In fact, she ended up going to several doctors, had some workups done. She just felt unwell, but she wasn't sure if there was anything deeper than that. She ended up coming to us. We actually recommended taking her breast implants out. And after her breast implant removal, her life changed. Her brain fog went away. She had so much more energy. She felt like herself again, like she had her life back. And so we contributed to this diagnosis that's becoming more popular, breast implant illness. So nowadays we're taking more out than we're actually even putting in. And that's why some of the holistic options that we have are just so much more favorable. So she's gone on to become an advocate for women. She is working with other women groups to really shed some light on this and really empowering other women. So I thought that was really, really special.
Well, it sounds like you already gave us a few, but what's the most life-changing transformation or most common transformation you've witnessed in your clinic?
I see so many stories, and I would say the best ones are those where we impact their life, we restore their confidence, and it just shows up in so many ways, in so many daily activities. I could have a mom who just is not feeling herself after childbirth and undergoes procedures for herself and feels like herself again. I can have an empty nester who their kids have graduated and off to college, and they're stepping up to say, you know what, it's me time. I'm going to do something for myself now. I've done my job, I've done my diligence to the world, and now it's time for me. That milestone wedding, that 25-year reunion, that 50-year reunion where they're capturing the pictures and it's really capturing their confidence. That man, that woman who is out in the next chapter of their lives, dating again and just wanting to be the best version of themselves and look natural. That teenager who has acne, who doesn't leave the house or doesn't go on social parties because they're just embarrassed, or now I'm able to treat them, and they now have a girlfriend and they're going to social activities again. That melasma patient, that blotchy pigmentation, who literally wears pounds of makeup every day because they're not confident going out into the world, literally wearing a mask of makeup, but now they can go makeup free. So those are some of just the wonderful transformational everyday changes that we get to experience and I get to be a part of. And that's what's really, really special. And we talked about the importance of, saying no. We don't do treatments on everyone that comes in. We really see what they actually need. We don't do what they ask for. We do what they need. And I think that's what sets us apart. We, put together that plan for them, 5 pillars of health, along with in-office treatments, along with the 3 Ps to pre-skin, along with that 30-30-30 rule. And all of those together really help our patients to get to the result they're after and truly be able to live fully.
You offer your services at Elite MD Advanced Dermatology, Laser, and Plastic Surgery Institute, which is one of the largest plastic surgery and aesthetic centers. How did you become such a popular destination clinic that attracts celebrities and patients to travel from all around the world to visit you?
Well, we've truly seen patients all over the world from 6 continents, 25 countries, 49 states, and it's been a true privilege and honor. I think a lot of it has to do with trust and our expertise. We bring something that other practices, other med spas cannot. We are the largest dermatology, laser, and plastic surgery center, the largest aesthetic center. We are one of few multidisciplinary practices that operate the way we do. We are a skin of color center. We're a luminary site for research and development and clinical trials. We are a teaching center and offer mentorship programs for healthcare providers and students all around the world. We truly have skilled artists and skilled experienced surgeons and providers who are really good at what they do. They're focused at what they do. They're specialized in what they do. So, we have probably over 50 years of combined experience with all of us. We have seen thousands of patients all around the world. We offer our concierge care. We offer smooth, seamless service. Like I said, like our team is there at your side, cheering you on every step of the way. They are looking after you because safety is the priority at Elite MD. They are your guardian angels. And whether it is, a celebrity who's coming to see us or a political dignitary who needs some privacy to an executive who just wants to look their best and really, be out in the world, or that mom who just wants to feel better about herself and reclaiming her skin and body. We truly do it all. We tailor it based on what your needs are. And, when you want the best, you can't settle. So this is where we're going to bring our A game to you every time.
As you've mentioned earlier, lots of people travel to hopefully save money for aesthetic treatments. And honestly, how important is it for a dermatologist to be board certified? And have you seen many patients that need help with botched cases after traveling overseas?
Well, I will tell you, beauty is definitely something you do not want to be bargain shopping for. It will definitely cost you more in the long run, not only physically, but mentally and emotionally. And we have definitely seen it. It's absolutely important to see a board certified physician, board certified dermatologist, board certified plastic surgeon. And here's the difference. We don't just do, a weekend course on aesthetics and beauty. We literally put our time, our blood, sweat, and tears into 4 years of undergrad and then 4 years of medical school, 4 years of residency training, seeing tons of patients, seeing all of the complications that can potentially happen, and really being able to feel comfortable with every type of patient that we do see. It's not hard to inject Botox in doing these procedures. What's hard is the complications that can arise from that. And after you're done with your residency and your training, you are now a dermatologist, but then you sit for a board exam, and that allows you to become a board certified dermatologist. So being a physician who is then vetted at the highest standard is what that means. So being a board certified dermatologist is what you want to look for every time. Now, the cons of going overseas, doing these discount bargain hunting, even here in the States, I see it all the time. And I've seen things that go from botched permanent fillers. They don't know what they're injecting. They get it off the internet, to silicone that causes deaths, to unsafe surgeries, to infections, disfiguring scars. And I'll tell you, the amount of work and time and effort that goes into these patients is really countless hours, because you're not just dealing with the physical trauma, you're really also helping them through the emotional pain of having this done. So they end up paying more to come to see us after a botched surgery or having to do a revision case, because there's so much more involved in that. So just remember, safety is not negotiable. You want to go to a trusted place that has board certified physicians, that knows how to handle complications, that knows skin of color, because that's a whole other experience as well. Your well-being has to come first. I always say, get your shoes on sale, but don't get your face and your body on sale.
So how has co-founding one of the top free medical clinics in the country impacted your work today? And are you currently supporting any philanthropic or community initiatives?
I will say the most rewarding work that I do has been completely free. It's all of the nonprofit organizations that I've been so grateful to be a part of. I helped co-found one of the largest free student-run medical clinics in the country. I've been in the Guinness Book of World Records with the most amount of skin cancer screenings done in a day. I've helped survivors of domestic violence. I've partnered with organizations that help children and foster kids. I help fund education and scholarships for underserved women and girls in India. I've gone to Africa to help donate school supplies. These are just all things that are a part of how I grew up and what I do. At Elite MD, it's no different. So service remains our core mission of the practice. We continue those efforts through doing free skin cancer screenings and during Melanoma May month, during LPGA activities. We offer mentorship programs and internship programs to students who are interested in medicine. And the beauty is we're able to create long-lasting impact. Something I started 20 years ago still exists after medical school. And I'm just so proud to be a part of that. And I can, imagine how many lives have been impacted and touched as a result of that. And that's why I keep doing what I do. In fact, even my medical grade skincare line at Elite MD proceeds will go into continuing to fund education and scholarship for girls and women. So it's something that we all take pride in. It's something that we are all a part of. It's something that we all touch. And I think it's so important that you can heal a person, you can change a life, but you can really give freely, and you're going to help change an entire community. And I hope that I continue to have that impact and continue to instill that within my staff and my children.
Dr. Sonia, what do you see being the future trends of beauty, skincare, healthcare, especially with AI and new technologies emerging?
Well, it's an exciting time for sure. I think our world is going to look so different. Our landscape is going to look so different in healthcare, just 5 years from now. And it's exciting, and it's also a little anxiety provoking because we're not sure what direction we're going to be going. It can go either way. But I do believe that it's going to go global. I think that it's going to continue to be holistic. I definitely think it's going to be very AI driven. This is where you're going to get even more personal. You'll get personalized beauty that is combined with innovation, that is really going to be even more personalized for you and curated for you. I'm really hoping to be a part of that movement with Dr. Sonia AI. I would love to be able to help impact lasting change and help guide skincare treatments, help with plans and procedures, and really giving you the right advice. And I want to be worldwide access for just trusted information, because there's so much misinformation. I know it's only going to get worse with time, and I think that you definitely need to have a home that you can go to where you can have the trust and access to the correct information. So I think the future is definitely going to be smarter. It's going to be potentially safer and more personalized. And I really hope that Dr. Sonia AI is going to be at the forefront of that change.
Well, if we weren't already having a lot of fun, Dr. Sonia, we're about to have even more fun. Going to do some rapid fire questions in a second here, but on your social media, you're sharing valuable education and insights themed around shady tip versus beauty tip. So tell us a bit about that, and then we'll do some of those rapid fire questions.
Well, shady tip versus beauty tip. It's just my way, my fun way, my little game to really set the story straight. I want to cut through the noise. I want to debunk the myths. I want to make sure that all of that misinformation is cleared. So I give you my truth straight from the dermatologist. So for example, I will talk about a common trend called slugging. So slugging, what is that? Is that a beauty tip or a shady tip? Well, it's where you actually smear Vaseline on your face at night. Leila, what do you think that is?
I've heard that it's good for you.
It is. It's a beauty tip. I
It's a
do it.
beauty tip.
I do it
Okay.
myself. So if you know the dermatologist is doing, it's definitely dermatologist approved. So I love it because it locks in moisture. It really helps, especially in the winter months. Literally, like overnight, you're going to get that immediate hydration. It protects your skin barrier. So slugging, yes, all the way. So next one, beef tallow for the skin. What do you think, Leila?
That sounds shady to me.
You're right. It's a shady tip.
Okay.
So it's trending. Everyone, literally these days, my patients come and say, I'm using beef tallow on my face. And I'm just like, oh my goodness. It's not designed for your face. It's going to break you out. It's not backed by science. It's going to clog your pores. So that is an absolute, don't do it. It's a shady tip. So I hope that's gonna help with creating some information and debunking those myths. But you can follow me on Skin by Dr. Sonia for more of those, or contribute some, some ideas, and I'll let you know if it's truly a beauty tip or a shady tip.
All right, Dr. Sonia, here's the moment that we've all been waiting for. We've had a wonderful conversation thus far, but let's do some rapid fire questions. I'm going to throw some things at you, and I want to hear what your response is going to be. Dangerous skincare myth.
Do-it-yourself treatments in your kitchen. Be careful with do-it-yourself bleach, do-it-yourself lemon juice. I've seen some terrible hyperpigmentation, burns, and scars, so don't do it.
Don't do it. All right, beauty trend to stop.
I'm going to say overfilling. Overfilling your lips for sure. We don't want the duck lips, and we don't want overfilled cheeks. It's so unnatural. Let's go back to celebrate our unique differences and our beauty.
Yeah, here's something that a lot of people are going to be interested in. Fastest refresh without surgery.
There are a few. Some of my favorites, laser facial. You can get that glow in an hour. My favorite that I recently did was PRF, platelet-rich fibrin, along with microneedling. I got so many compliments after the treatment.
Most shocking botched case.
For me, it's silicone. I've seen some terrible work and terrible things happen from silicone injections overseas, but what's even more shocking, it was also right down the street.
Oh dear. All right. One skincare advice for all women.
Never skip your sunscreen. I will say that is the one thing that 100% of dermatologists will always agree on. That is your best anti-aging tool.
All right, Dr. Sonia, wonderful conversation today. Learned so much. Is there anything else that you'd like to add?
Well, if you're ready to transform naturally, we would love to see you in our office. There are a variety of different ways that you can reach out to us. You can DM us at Instagram, at our Instagram, Elite MD Spa. You can visit our website, elitemdspa.com. You can book a mini consultation to see if you're a good candidate for our procedure, our package of Elite Transformation. This is where we're able to turn back the clock 1 year, 5 year, or 10 years, really design a curated package just for you to get you to your goals. You can also download my 5 pillars of health to get you started right away to get you in optimal health. And you can also explore our medical grade skincare line on our website. Hopefully, we'll get a chance to see you soon, or just follow along, and you can learn some beauty tips and myths from us. And hopefully we'll get a chance to see you soon, because it really is time for you.
Well, that wraps up today's edition of Social News Interviews. A very special thank you to Dr. Sonia Bansal for sharing her expertise and insights. And if you'd like to learn more about Elite MD Spa and the services available, visit elitemdspa.com. I'm Leila Gulen. Thank you for watching, and we'll see you next time.